Hello and welcome back to Physio. We're in a series on helping you rehab after your breast cancer surgery. Today we have Deborah. Welcome, Deborah. Thank you so much for helping us out with this. Today's video is all about what we do after a week after surgery. So you've been through 0 to 3 days, you know what you've been doing for the first 7 days, and now hopefully things are starting to feel a little bit more comfortable and we're ready to push it that little bit. So before we get started, Deborah's just going to fill you in a little bit of detail of what her case is and where she is at, just so you know where to compare, so you're not too worried if her movement is good and yours is not so good.
Hi, I was diagnosed with breast cancer 7 years ago and have had the operation, chemo, radiotherapy, Herceptin, tamoxifen, so I'm 1 year off tamoxifen.
So Deborah's well down the line, so please do not panic if you're watching this and Deborah's popping her hand up over her head with no problems, because it was not like that 7 days after she was out from surgery. So remember, our key message here is that your body will tell you where your limits are. Yes, it's going to be tight, it might be a little bit uncomfortable, but there should not be pain. If you're getting pain, then you need to stop and you need to consult your healthcare professional, your GP or your consultant that's taking care of you. If in doubt, you get it checked out. That's our golden message. We're here to guide you on what you can be doing based on the research from the American Cancer Society. So these exercises are in addition to the exercises that we've done from days 3 to 7. The key here is to get the shoulder moving. And in the last video we showed you how we were working into flexion, lifting that hand overhead. Now we're going to look at how we start to stretch that arm into rotation and we bring it out to the side. So we're going back to our golf club, which you would have seen in the previous video. There, you have a stand up for me for this one. Golf club or broomstick will work well, and your left side as well, aren't you?
Right side.
Your right side, so I'm going to come this way for you. So, end of the golf club is in that hand, and your left hand here is going to do the work. So keep your hands down at your side. Nice and slowly, what you're going to do is use your left arm to bring that right arm up, 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 and into the air. Good. Perfect. And then you're going to come down, nice and slowly. Now just a quick reminder, Deborah's down the road, so if this is day 7 and you're thinking, I can't get my arm up there, do not panic. On day 7, we come as far as we feel comfortable. As soon as it starts pulling, you stop, back down you go. Okay, and you'll feel it tight underneath the armpit, underneath the shoulder, and maybe even on top of the shoulder where it can be pinching. Bring it out again for me for number 3. You're coming up, up, up. The left arm's doing the work as far as you feel that you can. What do you feel at the top?
A wee bit tight.
Where?
Just in front
Front of the
breast.
chest wall.
Yeah.
So we're talking here.
Yeah.
So just so you know where you should feel it. And back down. So obviously, if you've got wounds and stuff along here, they're going to pull at them. You want to feel it tight, but not painful. And again for me. So we're looking for 7. Up, up, up. Good. And that's the speed. Nice and controlled. The left hand is doing the work here. 2 more, pushing up. And as soon as this gets comfortable, you start to push as far as you feel that you can. We've got to get that arm moving. Remember, we're using that arm as normal as we feel that we can. We don't want it in on our side. We've got to get moving it. And relax it down. So that's our first add-on to our previous video, moving that arm out to the side. So the next exercise we're looking at is trying to stretch out the muscles in front of the chest wall. This can be uncomfortable because this stretches the area that often has been operated on. So first and foremost, Deborah's going to show you what we're going to do. So you're going to put your hand on the wall for me, and you're going to try and face that hand away from you. Now, nice and gently, you're going to move your body round until you feel that stretch. This one you need a little bit of caution with because it can be uncomfortable. What do you feel there?
It's quite tight along there.
Tight along there.
Yeah.
So you're only coming as far as you feel you can, and then if you need to, you just bring the tension off slightly by rotating that body back towards the arm. And then you come round again, holding in that uncomfortable position for about 5, 4, 3, 2, 1, and relax off. Now, early doors, you mightn't get anywhere near that range of movement, and what you do is you just go as far as you feel that you can. You might only hold it for a second or two and come back round. One more for me. And then back round. And you can see even now that that is uncomfortable for Deborah, but it's okay to feel tight as long as it's not painful. And when we were doing this earlier, Deborah was just saying she feels this on the other side as well. She had a porticath on the other side, and she has scarring on the left side as well. This is a really, really important point. If you've had stuff going on both sides with different types of investigations or procedures, you must do these stretches on both sides. And to do that, you do the same thing but in the other direction. So if you put the left hand, just face that left hand away, other direction, yeah, perfect. And then you're turning that body towards me. And again, you're going to feel that across the front of that chest.
Not as far as this one.
And so she can feel the tightness even though the procedure was on the right side. It's actually the porticath that's causing the problem on this left side with scar tissue in front of that chest. So you go as far as you can, you take the tension off. And then back round. And again, this can be very sensitive in those early days, so only as far as you feel comfortable. And if it's painful for the first few days, come back to when you've reached day 14 and try it again. If in doubt, you get it checked out. Great, 2 more for me, turning that feet around, feeling that stretch. And when you're getting into it, you can look over the opposite shoulder and you'll feel all of that pressure along there. And the last one. Holding it for 2, 1, and then relaxing off. Good, well done. The other thing that I just wanted to talk about at this stage, so we're now 7 days after we've had our procedure, we're hopefully home and everything is going okay. And we want to start to think about getting back to our cardiovascular exercise. So again, this is going to vary for everyone. And really the studies are telling us that you need to self-pace when you're getting back into your cardiovascular activity. What I'm talking about here is simply walking. Experience will tell us, and I'm sure the ladies here would agree, that this is going to start very small. And I mean 5 minutes of putting one foot in front of the other at a very slow pace on a flat piece of land until you start to build things up. But that can start as soon as 7 days post-op, if everything is going to plan and you're feeling okay. So what you do is you get well wrapped up, you find somewhere that's nice and level, and you just see how you get on. You start with 5 minutes and see how you feel. And it mightn't be at the time. It might be later on that day that you feel fatigued and tired. And that will tell you, okay, you know what, for this first week, 5 minutes is my limit. And I can't write on any sheet of paper how to build that up. It is self-paced. Every week you say, all right, I might try 6 minutes. I might try 7. And slowly but surely, it'll build up.
Yeah.
What would your experience be of that walking after surgery?
Oh, it's a few weeks, definitely.
Yeah. And that's the key to this, that everyone is going to differ. But if you're feeling it, it's okay and it's safe to do it. That's the message. If you feel you can try, it's safe to do it. Because I think fear is the big thing, that something is going to happen if you do it, but you can't. It's good to increase blood flow, it helps with swelling, and it'll help you clear your head to get outside for a few minutes every day. So the biggest add-on from our previous video to fill your rehab for the first 2 weeks is your abduction, so you're helping your arm out to the side, starting your stretch against the wall for those tissues underneath the armpit and in front of the chest wall, and then to start to think about how you're going to bring in your cardiovascular rehab with it simply starting to walk. Start with 5 minutes and you self-pace that up as far as you feel that you can. Our next video is all about starting to think about our strengthening exercises once we've regained that shoulder range of movement.